This is All India Radio. In the program Spotlight, now we bring you an exclusive interview with Lav Agarwal, Joint Secretary, Union Health Ministry on measures to tackle COVID-19. Interviewer is Bhupendra Singh, AIR correspondent.
It has been observed that the Omicron variant has more transmissibility in comparison to previous variant, though hospitalization is low. So how has the ministry recalibrated its strategy to combat this new challenge?
Let me just highlight, Omicron variant is found to be highly transmissible. Also, it has a shorter incubation period, which means if you are infected, it can lead to faster spread of infection as well as early sort of highlighting of symptoms, but it is also mild. Taking that into consideration and taking based on all the available evidence from world as well as country, we realize that our ongoing strategy, which is based on 5 strategic principles, that is test, track, treat, vaccination and adherence to COVID appropriate behavior, still remain applicable even to this variant, even within the overall framework of COVID-19 management. Having said that, it is very critical for us to understand that since most of the cases will be mild, and the fact that this is a highly transmissible variant, it is important that we continue our focus on containment aspects. If we just follow those principles where if need be, because the virus does not infect on its own, it infects if we provide it an opportunity to infect. If that be the criteria, if we focus on containment and we do not allow virus to infect others, to that extent we will decrease the number of cases within the country. Second is being mild. It will be a situation where larger number of patients would require home isolation. In those cases, what are those home isolation protocols? Are they being followed properly? That is what we need to focus. Third aspect is some of those patients which are in home isolation may require follow-up in the hospital setting. So to that extent, we understand, revise our clinical management protocol, upgrade our health infrastructure and see to it that we are able to manage all the cases which need hospitalization. And most important aspect, community support, community awareness, alertness within community in terms of understanding that since it is a highly transmissible virus, we need to follow COVID appropriate behavior, which is primarily use of mask and following 2 gaj ki duri, physical distancing as a new normal in our life.
Sir, while dealing with the first and second wave of the pandemic and the simultaneous vaccination drive, there was massive data sharing between the center and the state administration. So how helpful has this data been in devising the new policy guidelines?
Actually, the whole COVID-19 management in this country has been primarily data-driven insights. From moment one when the COVID pandemic started happening across the world, we created a COVID-19 portal through which we collated data which came from districts and states and which made us understand what is the trajectory of the cases across the country. So if you see, when we even provide our data to community at large, we are able to highlight which are the places where cases are rising, and these are the places where you need to take a public health action in terms of containment and other measures. Similarly, data provides us insights in terms of understanding where if death is happening slightly in higher number, is it because that the home isolation patients are getting late? So to that extent, we follow our surveillance mechanism slightly much more strengthened that also. Third aspect is the data from the clinician side provide us details in terms of understanding what additional changes need to be done in the clinical management protocol, what type of medicines may be useful. So our national task force take those details into account in terms of defining the clinical management protocol. So what I would like to highlight is that it is these data-driven insights which make it important and useful for us to understand the trajectory and take the required action at the field level.
Sir, the Union Health Ministry has recently revised the guideline for home isolation of mild and asymptomatic cases, as over 90% of the COVID cases are either mild or asymptomatic. So what are the salient features of the revised guidelines?
Most of the COVID-19 Omicron cases are supposed to be mild. And since that be the situation, we would realize that larger set of people would primarily go for home isolation. Taking the available evidence into consideration, these home isolation guidelines have recently been revised. Only mild or asymptomatic people should go for home isolation. If you are having moderate or severe symptoms, you need hospitalization. Second aspect is who are the set of people who should go for home isolation. So these are people who have sufficient rooms within their house where a positive person can remain in effective isolation in a very ventilated space, and there is also room available within that house for quarantine for other family members. Third aspect is that there should be a caregiver to provide support to the person who is positive, and this caregiver, as we have specifically highlighted, he should preferably be a person who has completed his vaccination schedule. Fourth aspect is we have highlighted that it is important that the caregiver should remain in touch with the medical officer so that the required technical support can be provided. Fifth aspect, people who are comorbid, they should only go for home isolation as per the prescription given by their treating medical officer. And there are some set of people who may actually be having immunocompromised status. Like for example, set of people who may actually be having cancer. So those set of people are generally not recommended for home isolation, and it should specifically be done as per the advice and the acceptance given by the treating medical officer. We have prescribed certain specific guidelines to be followed primarily by the patient. Patient should at all point of time use triple layer mask, and he should discard this mask after 8 hours of use, or if the mask is wet or soiled. Similarly, we have suggested that if a caregiver is entering into the room, he should use a triple layer mask, and if they are in close contact and if feasible, they can even use N95 mask. We have suggested the patient to actually take adequate rest, maintain his hydration. He should also follow respiratory etiquette. He should maintain hand hygiene, and there should be no sharing of whatever the patient is using, including utensils, with the other members of the family. Parallelly, we have suggested that the patient should self-monitor his health, particularly with respect to oxygen saturation, the temperature, etc. We have also suggested that patient should continue his medication in discussion with the treating medical doctor if he has an ongoing comorbid condition also. We have also specifically highlighted that it is important to use telemedicine because you are staying at home and you would need guidance. So either it is the e-Sanjeevani platform made available by Government of India or any other platform available, he should make use of that platform to remain in touch with the treating doctor. He should take medicine based on advice for the symptomatic management. If he has fever, he should take paracetamol, etc. And we have also specifically highlighted the point that even if after taking 4 paracetamol tablets during the day, if the fever is not falling, he should immediately get in touch with his doctor. We have specifically mentioned that non-authentic and non-evidence-based treatment protocols which float on social media, because they actually end up harming a patient. We have suggested that you should not go or fall prey to those non-evidence-based information, because it will harm you, it will create panic, it will create an element of anxiety which is not needed. We have also specifically highlighted whether it is blood test or whether it is X-rays or MRIs or CT scans, unless it is prescribed by the doctor, kindly do not go to them. I would like to also specifically highlight about steroids. We are all aware that people act out of anxiety at times because of this type of information floating in social media and otherwise. They have to understand that steroids are not to be given for mild and asymptomatic patients. And there are evidences in front of us that if you are taking steroids without required prescription, without required follow-up, then it may lead to secondary infection. We all heard about mucormycosis, the fungus infection. So we have specifically highlighted that kindly do not take steroids.
Sir, with the onset of the third wave, the public perception about the COVID vaccine has changed, given the fact that despite successfully administering over 150 crore doses, the new variant is still spreading at an unprecedented rate. Can we infer that the vaccination drive has helped reduce the severity of the pandemic, but more needs to be done in terms of reducing transmissibility?
We all need to understand that as per the available evidences across the world and even in India, it is vaccine along with the social vaccine which I talked about, that the use of masks, physical distancing, it is this vaccine which is going to be our biggest support. The evidence clearly indicates that if you are fully vaccinated, you have much lesser chances of getting infected, including even Omicron. Evidence also clearly indicates that if you are fully vaccinated, your chances of hospitalization are much lesser. And third important aspect is evidence also indicates that if you are fully vaccinated, you do not get severe infection. So my request is that it is critical that as and when the vaccines are made available and you are eligible, kindly get yourself fully vaccinated.
So what additional efforts are being made to tackle the vaccine hesitancy in the current scenario?
From moment one, we had a very clearly defined communication strategy with community, through which we had actually got required support in terms of, now when I say that we have done more than 150 crore vaccine doses being given in the country, so this is part of that approach. Equally important is the human service done by our field staff. I am sure you would have seen those videos where our ASHA workers, where our ANMs have crossed mountains, have crossed rivers to go to the farthest areas of this country, educated people and did the vaccination. We have also taken help of community at large, whether it is our community-based organization, NGOs in the country, civil society organization, village elders. everyone has been supporting in this initiative, and that is how we have been able to cover this benchmark of 150 crore plus vaccination doses in this country, the world's biggest vaccination drive. Now, parallelly along with this, we have also, based on the emerging evidence, we have expanded our program, and I am happy to highlight that we have started vaccination for 15 to 18 age group also. Parallelly, we have started precaution dose for our healthcare workers, for our frontline workers, and for our people above 60 years who are having comorbid conditions.
Sir, has the government set any particular timeline to administer the precautionary doses to all eligible population?
We have done more than 150 crore doses. We have covered 92% of our eligible population with first dose. We have covered 69% of our eligible population with second dose, and 40% of our identified population between 15 to 18 years has already been given the dose between in that particular age group also. We have recently launched our precautionary dose, which is primarily meant for our healthcare workers, frontline workers, and elderly people, because we realize that it has impact in terms of providing them additional immunity. And in this, our submission, our request is that all eligible people between 15 to 18 age group, as well as all people who are eligible for precaution dose, should take those vaccination ASAP, as soon as possible.
Sir, the government has recently sanctioned vaccination for children above the age of 15. Is there any ongoing effort to ensure vaccine shield for the children below that age?
Whole of our efforts in terms of managing COVID-19 since beginning has been focused on a very important parameter. Work with the available scientific evidences, go based on an evidence-based approach. And based on that approach only, you would have realized that we started with vaccination for healthcare workers initially, January 16 of last year, added frontline workers, added after that elderly people, and then made it free to community at large, and then we have reduced it up to 15 to 18 years. Based on the emerging evidence, based on the scientific approach, whatever needed to be done in terms of supporting the community for management of COVID-19, those decisions will be made applicable across the country.
The government is provided India COVID-19 emergency response and health system preparedness package phase 2 for strengthening health infrastructure across the country. What tangible results have been observed so far?
We provided 23,000 crore rupees plus under emergency COVID response package, and we have realized that we need to focus on upgrading the available health infrastructure for management of COVID-19, and it is through this fund we are focusing on creating beds, isolation beds, beds with oxygen, ICUs also we are being updated. We have also worked towards ensuring that we create field hospitals through this fund. We have worked towards creating additional pediatric ICU beds, additional pediatric ventilators through this fund. We are working towards increasing the testing infrastructure, providing RT-PCR labs across the country. We have used this fund also to provide liquid medical gas pipeline as well as the liquid medical storage tanks in the hospitals across the country. Besides this, we are utilizing this fund also for creating and incentivizing the human resources for management of COVID-19, creating a buffer stock of drugs.
Sir, how is the PM Ayushman Bharat Health Infrastructure Mission going to play a critical role in building capacities to tackle public health emergencies including COVID-19?
Under Ayushman Bharat Health Infrastructure Mission, we have launched a mammoth program at the directions of Honorable Prime Minister, wherein 64,000 crores rupees are to be spent in terms of upgrading health infrastructure across the country.
Sir, referring to what you have been saying as Ladai Nahi par Suraksha Wahi, can you please elaborate on this, and also what according to you will be the critical determinant in our fight against the Omicron surge?
It is Ladai Nahi, Suraksha Wahi, which means whatever are our principles for management of COVID-19, they remain applicable even for Omicron variant. And these principles are fivefold strategy: focus on testing, focus on tracking, containment, focus on treatment, ensuring that everyone gets vaccinated, and parallelly ensuring that everyone followed COVID-safe behavior, COVID-appropriate behavior. With these parameters, we have also specifically highlighted that within these components, since Omicron will primarily be mild, we need to ensure that our home isolation is followed to the T and everyone follows those guidelines. First thing is we are able to save ourselves and we parallelly do not spread infection amongst our family members. We have also focused on early identification in terms of focusing on our testing network, and third, we have also focused on the treatment aspect.
Thank you very much, sir.
You were listening to an exclusive interview with Lav Agarwal, Joint Secretary, Union Health Ministry, on measures to tackle COVID-19. Interviewer was Bhupendra Singh, AIR correspondent. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app, News on AIR. This program is also available on our YouTube channel, News on AIR Official.